Suffering a meniscus tear can be so scary because you hear so many people that end up having surgery after they've had a meniscus tear. Very often, the surgery leads to worse problems like knee arthritis or even a knee replacement surgery. In more recent medical research, we're finding that there's a direct connection between certain types of meniscus surgeries and knee osteoarthritis development. So figuring out what you can do early on when you barely found out you have a meniscus tear is really important so that you can decrease the chances that you're going to have problems later on in life in your knees. One option that's non-invasive, non-surgical, all natural is wearing a knee brace. In this video, I'll be giving you my honest physical therapist opinion about which kind of knee brace is best if you have a torn meniscus. But first, let me answer a question that you're not going to know to necessarily ask. It's, do all meniscus tears require a brace? The answer to this is no. Not all meniscus tears are going to benefit from wearing a knee brace. In fact, my suggestion to most people that have a meniscus tear and are considering using a knee brace is to give it a week. Find a knee brace that works best for you, because finding a knee brace is a bit like shoe shopping. You have to find the right size, the right fit. You may even need to try different brands. There's different options out there, many different options for knee braces. And just because the first one you try on doesn't help you at all, it doesn't mean that no knee brace will help you at all. I strongly suggest you go out and purchase 3 to 4 different types of knee braces, purchase them all at the same time so that you can try different ones out without having to go through the process of returning one, waiting time, and then trying out another one, and then returning that one and waiting. And just get 3 or 4 all at once so you have them ready to go. And usually you can return these to stores wherever you purchase them, even on Amazon, and it won't cost you anything to do that. Now, sizing does matter, so if you get a knee brace that fits you very tight, that doesn't mean that brace isn't going to work for you. You might need to get the same kind of brace, the same brand, the same style. Just get a size up, or if it's too loose, get a size down, and that might solve the problem for you. And it's totally worth it to go through this process if you want to avoid surgery, because some people just give up after the first time or two they run into problems with trying out knee braces because it doesn't fit, they slide down. There's all kinds of little issues that people run into. But once you work all those little issues out, you find the right brace, and you get going on with the correct brace, and you actually get some relief, now we're talking. You might have an excellent chance at avoiding a knee surgery altogether with the help of this knee brace. Now, let me just give you a few more tips, and then we're going to talk about a specific brace. You don't need to wear the brace at night, and really you just need to wear it when you're up on your feet doing things, because that's when the meniscus is going to take the most pressure or activity. If you're just going to relax at the end of the day, or if you're just having a meal, you're sitting watching TV, watching YouTube, something like that, it is okay to slip off that brace. But if you know you're going to be up on your feet running errands, doing chores around the house, just being more active, that would be the time that you want to have the brace on, because it does get tiring to wear the brace from when you wake up all the way to when you go to bed. And you got to take a shower because that brace gets sweaty. You got to wash the brace. There's other little things you got to deal with the brace, but totally worth it if you can avoid the rest of your lifetime dealing with knee troubles. Now, let me tell you about this knee brace. This is my favorite knee brace for meniscus problems. It's called the Shock Doctor. It's a dual hinged bilateral brace, meaning it has a hinge on each side of the knee, and each hinge has 2 hinges within it. So it's actually got 4 hinges total. These do come in certain sizes, so this is the XL. This is the one that fits me properly. And the sizing chart, I have to warn you, is a little bit off. I usually recommend my patients get one size above wherever it measures you. It's got a sizing chart on the website on Amazon. You can find this. I've got a link in the description to this brace on Amazon. Whatever sizing chart it goes by, I recommend you get a size up. That's been my experience. Isn't perfect for everybody, but that's what tends to happen. The fit of this brace tends to be best compared to other braces, the way that it's tapered. It's got the little hole there, and then the straps that go around really cinch it down pretty well. Let me open it here so you can see the actual brace. So here are the straps that go all the way around. This is the top right here. Here's the bottom. You know that you're on the top because the tag sticks out right there. That's always on the top. And it's got these little hooks for you to dig your fingers into so that you can pull the brace up. It's just a well-designed brace. It's got this neoprene and spandex material. It's quite comfortable as braces get anyway. And you can feel the hinges on the side of each side of the brace here. It's got this little window, this vent in the back, because that's where the knee gets the sweatiest when you have the braces on right here. So it's really good that they built that in. This is a good value compared to the braces. They run anywhere from $40 to $100 depending on the size, depending on where you're getting it from. But there's other Hinged braces out there that just aren't as good quality. You might find cheaper ones, but they break down quicker, especially if you're going to be using this for a while, as you probably might with a meniscus tear. Overall, I think this is the best bang for your buck if you're getting a knee brace for a meniscus tear. Let's go over some pros and then some cons of this knee brace. What I like about this is it generally fits most people. Once you deal with going up and down a size, I found that this brand tends to work for most of my patients. I'd say like 95% or better. I've only had very few patients that said they absolutely don't like this brace and they'll opt for a different brace, which is fine. I love the stability side to side. The hinges really block the knee from moving too much sideways, which is the big problem if you have a more severe meniscus issue. And that's why I think people get relief. If they have a more severe meniscus issue, then you have an increased amount of instability, or you just don't feel as stable in your knee. And so having these hinges block that side to side movement really helps out. Another pro about this is you can hand wash it in your sink. That's how you should do it. Just get a little bit of laundry detergent, plug up your sink so that you can create a little bit of a bath in there and just wash it, rinse it on itself, and then dry it up in your shower or wherever you want. They don't recommend you put this in the dryer, but you can dry it out in the sun if you have access to somewhere where you can put it out, and it should dry fairly quickly so that it's ready to go for the next day. Now, some cons about this. It's not machine washable, and actually Shock Doctor used to make a brace. I don't know if they still do, but this is what I've been getting lately, where you can remove the hinge. It's got little slits where you can kind of pull the material around the hinge, take the hinges out, then throw the brace in the washing machine and in the dryer, and that way it gets machine washed. You don't have that option with this one because the hinges are sewn into the brace. But talking from experience, I've used this brace before for my knee issues in the past. It's not that bad to hand wash. It really just takes a couple of minutes and then it dries fairly quickly, so it's not that big of a deal. Now, a common con with all knee braces, I've yet to meet a brace that doesn't have this problem, so this isn't just specific to the Shock Doctor knee brace, is they all slide down your leg. Once you have it on in place and you cinch it down and you start going on with your day, that brace tends to work its way down your leg and you find yourself constantly reaching down to pull it up because it just keeps sliding down. That just happens with every brace out there. I have not found a single brace that stays up. That's just one of the things that you're going to have to tolerate in order to avoid surgery if you're getting a benefit out of the brace. So you start by finding the tag so you know which side's up. Here's another tag here. And then you know that the knee hole is going to be on the front. Go ahead and slide your foot in, undo all the straps as well. The strap on the bottom on this one is still done, so I'm going to just undo that one. And then there's hooks on the sides here, little places for your fingers to slide in. Pull that brace up, make sure it's decently snug. And then you just cinch it down with the straps here. Now this one goes, I like to just put it under this thing right here so that it doesn't fray this and it gets a better grip. If the strap comes off like this, you just thread it through the little loop there, tighten it up, and you're good to go. Make sure your kneecap is about there. It's okay if it's not perfect. You just want to start with your kneecap in the hole, but once you get to moving around, it's going to shift from positions here. And you're going to find that it slides down as time goes on, so you have these little hooks here to pull it back up whenever you need to. So as you walk around doing things, you can always just cinch it back up. Now, I do tell people put this under your clothes ideally because it just comes on better, but some people do figure out a way to get it on over their clothes. That's fine. It should still give you the same amount of stability and support, but you have to figure out and play with it, troubleshoot, and see what works best for you. Let me give you my honest opinion as a physical therapist about the Shock Doctor Hinged knee brace for a meniscus tear. I really like this brace. This is the one that I recommend to my patients. Now, like I said at the beginning of this video, if you don't have relief within 7 days of trying this out, then it's probably not going to work for you. No brace is probably going to work for you. That happens very often. I find that about half my meniscus patients do actually benefit from a knee brace, and the other half say, no difference, didn't really help. It helps to do other things. But I do tell people, you're not going to know if you don't give it a try. Many people have tried it out too, so I just refine that and I tell them, try a different kind of brace, make sure that it fit well, give it a good 7 days. If you only tried it for an hour or two, that's not enough time. You have to see how you feel at the end of the day day one, and then as you accumulate days wearing the brace in a row, then you can really judge the impact of the brace for you. And on the other end, I've seen some people force their way through wearing the brace. They put it on because they think it's what needs to be done, or maybe somebody told them to wear it, and it didn't really make a difference. It's kind of getting in their way more than helping them out. So I'll tell them, you know what, just ditch the brace. You're doing fine doing other things. You might need to offload the knee some other way using crutches or a cane, or there's a bunch of other techniques or different approaches you can use to depressurize your knee. Which takes me to the last point of this video. How do you get long-term relief from a meniscus tear so that you can heal naturally? I talk all about this on our channel here. I've got a playlist down in the description below called Knee Meniscus Help. Go check that out if you want to learn more about how to heal a torn meniscus naturally. And then if you want an even more comprehensive plan for healing your meniscus, then go learn about our Knee Meniscus Recovery Program. You'll also find a link about that in the description below here. If this is your first time meeting me, my name is Dr. David. I'm a specialist physical therapist. This channel is dedicated to helping people stay healthy, active, and mobile. And we make videos that are helpful with tips, exercises, stretches, and advice for staying healthy for the long term. Thanks so much for watching, and I'll see you in the next video. Bye-bye.